The reason why we're addressing the press is because we want Kenyans to enjoy whatever the Constitution assures them of, that right to healthcare. And as stakeholders of oral healthcare, we want to have the message reinforced and shared across all Kenyans. And the fact that Kenyans deserve the best of standards in access of oral healthcare services. With us today, and before you is the leadership of the Kenya Dental Association, and myself, my name is Dr. Kahura Mundia, accompanied by the Secretary General, Dr. Arnold Malit, and the rest of the council members. We are here to speak about the status of dental care services access in Kenya, and the fact that Kenyans deserve the best of standards in access of oral healthcare services. The reason why we're addressing the press is because we want Kenyans to enjoy whatever the Constitution assures them of, that right to healthcare. And as stakeholders of oral healthcare, we want to have the message reinforced and shared across all Kenyans. That dentistry is part of oral health. That dentistry is part of medical health. And the mouth is not a different body part than the leg. So the mouth is equally important, just like the leg, the hand, and any other body part. And many other disease conditions affect the body, and all of them contribute to the quality of health of that individual person. So we appreciate the efforts of the government by steering us forward through a national oral health policy and the national strategic plan towards oral health care. However, we see a position whereby that this policy and strategy has not been implemented to the direction that we deserve as Kenyans. And as stakeholders of oral health care, we speak to the government, the national government, and the county government to consider prioritizing access to oral health care services to Kenyans. The facilities that we serve at, most of them are public facilities, do not have adequate personnel, and we want dentists in those facilities. We'd hope to have dentists, as many as they could be, so that Kenyans can have their matters addressed. It is, however, unfortunate that SHA, the social health insurance that we designed as Kenyans last year, is yet to cover dental care benefits. Kenyans should ideally enjoy a minimal benefit on this social health insurance coverage. We could start with the pediatric age group, that's our children, because they're exposed a lot. The disease burden of oral healthcare diseases, it's quite high in the country. And the studies show that many Kenyans deserve attention on oral healthcare matters. Persons with chronic conditions like diabetes, cardiovascular diseases, they are affected by the neglect of oral healthcare. So whenever we do this, our quality of healthcare outcomes goes low. So we want the government to prioritize access, access to oral healthcare services by having qualified persons providing services to Kenyans in the manner that they deserve, and a national cover to pay for the same services, because services are quite expensive, and paying out of pocket for dental care services is not sustainable. So the government should offer that cushion through the social health insurance package. So we call upon the SHA authority to consider to fast track the process of designing a tariff that Kenyans can benefit on these particular issues. Further, on the issues of quackery in dentistry, Because you have many places where we don't have dentists, and you have persons masquerading as dental providers. That reality needs to change. We have enough dentists in the country to serve at both private and public sectors to offer these much needed oral healthcare services. So we call upon the regulator to do what they are mandated to do, to go out there and assure Kenyans that whatever services they are accessing, whoever is providing these services is duly licensed and qualified to offer their services in the scopes of practice that they were trained upon. Because without that, we keep to harm Kenyans and expose them to more risks that are avoidable. And more risks means more expenses towards the healthcare system, more admissions, and sometimes even loss of life. No one should lose a life because they went to see a quack, they got an infection that could have been managed, but again, because the covers were not working, the social health insurance, then the matters become worsened off. We do not want that as Kenyans. We want our stakeholders to continuously engage with the government to assure Kenyans of the right to oral healthcare services. Thank you.
We have a meeting slated.
Thank you. We have raised these matters to the Social Health Authority and to the Benefits and Tariffs Panel that Kenyans deserve that coverage. They have set down meetings and we await them to honor what the Constitution provides, which is the assurance of a right to healthcare. And healthcare is diverse. In this particular instance, we are showing the relationship, the integration of oral health with the general body medical health, because they are important. And yes, we'll soon be meeting with the SHA authorities on those matters. Thank you.
Kama kuna swali funga.
Any other?
Is there need to mention we had a meeting now? We had any meetings?
Yeah.
Any other matter? Question?
Naona iko sawa.
Talking about regulation. So far, in terms of getting rid of drugs in the sector, how is it implemented? What are the actions?
Okay.
KMPDC
Thank you.
mandate.
The mandate of ensuring that Kenyans access the highest standard
Quality.
of oral health care rests with the regulator, Kenya Medical Practitioners and Dentists Council. It's a body that issues licenses to all persons who are qualified as dentists. It's the same body that's supposed to inspect facilities to ensure that the facilities are manned by persons who are qualified. But maybe we have seen that some of those facilities are not manned by qualified personnel or personnel who are working beyond their scopes of work. But it is the regulator who is supposed to go out there and scout for this mischief and ensure Kenyans have the highest standard of service delivery. So that rests with the KMPDC. We are yet to see their efforts. And that's why it's sounding a reminder that they need to do more so that Kenyans can be assured of the best standard of oral healthcare access.